Spiritual care. What chaplains do for patients, loved ones, and staff. What do chaplains do? Chaplains enhance feeling and meaning for all people, and not simply the religious beliefs or practices for those who consider themselves religious. In other words, we start at the deepest level, down where it all begins for us. For everyone, there is some personal meaning to what's happening in their life, to life itself in general. And from that meaning flows their feelings. So it looks like this. There's just a few basic things we feel about reality. So when we think something's good for us, we love it. We want more of it. When we think something's bad for us, we hate it. We recoil. We try to get away from it. When something good is present, we feel glad. We feel joy. And that joy is our emotional strength. It's the north on our psychological compass. It's where we want to head in life. And when something good is gone, then we feel sad. We feel sorrow. And when it's gone or something bad is present and it's hard to take, we feel mad. When something is not present, but it's not hard to have, we desire it. When something isn't present yet and we think we can have it, we feel hope. When we think we can't have it, we feel despair. When something isn't good for us and it's simple to avoid, we feel aversion and we just move away from it. If we're at a crosswalk, we see a bus coming, we just step out of the way. When something is bad and it's hard to overcome, then we may feel we can, and we feel confident, brave. So for instance, when the Allies resisted Nazi Germany, it was not easy to overcome and avoid them taking over the world. We had that bravery, and with determination we overcame. When a person doesn't feel that they can overcome, they can avoid, they feel afraid. Those are the basic feelings we all have. When we notice someone is sad, that reveals something about what they love, what they value, what brings joy, a goodness gone. And it's an invitation to celebrate that goodness, to keep it around. So for instance, when somebody's lost a loved one, it's best when they keep those pictures around and tell the stories, and they don't try to shut it out of their memory. We are emotionally strongest when we continue the connection. What chaplains do is they enable people to integrate all the good in their life. They enable them to integrate all that's happening and stay oriented to their joy. Anger is an invitation to find creative means to change the situation or the peace to accept it. Those are the basic feelings that we have, and we find those clues and we work with people. We help them dive deep and then come up for air. We help David face Goliath. We help players win their Super Bowl. What we do is we find out what's worked for them in the past spiritually. emotionally, the intangible strengths that they have, the connections. We help them to align with their greatest joys and choose the better part in life for themselves, what's still left. And in this way, chaplains help patients, loved ones, and staff enhance their greatest joys by strengthening their faith, their confidence, their hope for the continued good, and the love for the greatest things in life. That's what we do.